Astrazeneca's long-acting monoclonal antibody combination has received emergency use authorization in the US for pre-exposure prophylaxis of COVID-19. Evusheld is a combination of two monoclonal antibodies, tixagemivab and cilgavimab. It has been authorized for pre-exposure prophylaxis, meaning it is to be used before you get COVID. In this video, a little bit of an overview on Evusheld, if you are a candidate for this monoclonal antibody and how you should be going acquiring it as per my understanding. A monoclonal antibody is an antibody made by cloning a unique white blood cell. In the case of Evusheld, it is derived from cloning the B cell of convalescent plasma. These are antibodies that are similar to the ones your body would naturally make in response to a COVID infection. However, monoclonal antibodies are mass produced in a laboratory. These monoclonal antibodies interfere with the ability of the virus to attach to human cells. Evusheld is a combination of two monoclonal antibodies. These are long-acting antibodies, meaning they provide protection for long periods of time. As of now, they are known to provide protection for 6 months, with further studies ongoing for longer durations. The efficacy of these monoclonal antibodies seem to be good, averaging at around 80%. This includes the Delta variant. However, the studies for the Omicron are still ongoing. Evusheld has been developed with financial support from the US government. Astrazeneca will be supplying the US with 700,000 doses. These doses will be distributed amongst all the states on a pro rata basis. And the good news is that it will be given to you free of cost. These monoclonal antibodies, as of filming this video, are still not available to you, but it is expected at any time in the United States. And I have heard lately that Singapore and Bahrain are also in the process of granting it the EUA. Evusheld is administered in 2 shots given intramuscularly. This differs a little bit from other monoclonal antibodies which are given in an IV drip. The use of this therapy, however, has got a very strict eligibility criteria. This therapy comes with a word of caution that it is not meant for treatment of COVID or post-exposure prophylaxis. You should consider consulting a doctor for this therapy if you have any type of cancer, are immune suppressed, or are receiving high doses of corticosteroids, maybe due to some autoimmune disease. It can be used in children only if the child is over the age of 12 and weighs more than 40 kilograms or 88 pounds. I, however, am not clear if you can have access to these monoclonal antibodies if vaccinations are contraindicated for you, as in case of maybe you may be having an allergic reaction to vaccines or a history of anaphylactic shock. I have left a full list of the criteria down in the description which you can download for your reference. Just remember that these monoclonal antibodies are not a replacement for a vaccine, but has a very specific use case scenario. To my understanding, once Evusheld is available in the States, you will have to contact your healthcare provider and sign a declaration that is bound by law in order to avail of this therapy. I do not know as of now if the other countries will be following a similar procedure. Evusheld as of now is not recommended for use in pregnant and lactating women and children under the age of 12. Also, the effects of people having liver disease is not known. As far as for the adverse reactions, nothing serious was found in the trials. However, there was a slight increase in cardiac events. But to note here is that these patients already had cardiac risk factors prior to taking this therapy. Like, subscribe so as not to miss out on future updates like this one. Signing out, Dr. Rohan Fonseca.